everyone, my name is Letitia Gordon and I'm one of the certified nurse midwives here at Adriatica Women's Health. First, congratulations on your pregnancy. Whether this is your first baby, your fourth baby, or somewhere in between, we are so glad you've chosen us to walk through this journey with you. This is our OB education class, and over the next 30 minutes or so, we're going to walk through pretty much everything you'll want to know about your prenatal care, from your very first appointment all the way through delivery and into your postpartum recovery. You should have our pregnancy guide either as a printed booklet or as a PDF. We're going to move through it page by page, so feel free to follow along and grab a pen if you want to jot down questions as we go. There will probably be a lot of them, and that's a good thing. You'll see chapter markers throughout this video, so if you want to jump to a specific topic like medications you can take or what to expect in labor, feel free to skip ahead. Come back as many times as you need. All right, let's get into it. If you flip to page 2 of your guide, you'll see all of our providers, our delivering physicians, our midwives, and our nurse practitioners. A really common question we get is, how do I know who's going to deliver my baby? And honestly, that's a great question because the answer is it depends on who's on call when you go into labor. We are a group practice, which means our providers rotate. We each take a 24-hour call shift once a week and a Friday through Saturday, Sunday weekend call shift about once a month. The schedule shifts week to week, so the doctor or midwife who happened to be on call last Monday isn't necessarily the one on call this Monday. What that means for you is this: a lot of patients find one provider they really click with, and we love that. But we also strongly recommend that you try to meet with each of the other providers at least once during your pregnancy. That way, when you walk into labor and delivery at 2 in the morning, the face on the other side of the door is someone you know. The same goes for our midwives. It might feel like a lot of names at first, but I promise by the end of your pregnancy, you'll know us and we'll know you. Page 3 of your guide covers our office locations and how to get in touch with us. We have 2 offices, one in McKinney and one in Prosper. Our providers rotate between both locations, so it's the same group of doctors and midwives. We're just at one office one day and the other on another day. What that means for you is flexibility. You don't have to lock in to a single location. If McKinney is more convenient for you one week and Prosper works better the next, just book wherever is easiest. Your records, your labs, your notes, everything follows you in our electronic system. You'll get the same care either way. Now, when it comes to delivery, we only deliver at Baylor Scott & White Medical Center in McKinney off of Lake Forest. A few things I want to highlight about Baylor McKinney specifically. Every delivery there includes delayed cord clamping, immediate skin-to-skin contact with your baby, and access to lactation specialists who can support you with breastfeeding right from the start. They also have a level 3 NICU on site, which is reassuring if anything unexpected comes up. They offer nitrous oxide, which is laughing gas, as an option for labor support. They have birth balls, peanut balls, and showers for water therapy. And every one of their nurses has been trained in something called spinning babies, which is a set of techniques for helping your baby rotate into the optimal position for delivery. So how do you reach us? The main office number is on page 3, and we've also printed it again in bold on page 11 for quick reference. During business hours, we have a dedicated nurse whose only job is to answer calls from our pregnant patients. She's in close communication with your provider, so if she can't answer your questions right away, she'll get the answer and call you back. After hours, weekends, and holidays, calls go through to our answering service. There is always a midwife and an OB on call 24 hours a day, 7 days a week. So if something feels urgent, please don't wait. Pick up the phone. We would rather hear from you and tell you everything's fine than have you sitting at home worrying. Let's talk about what your prenatal visits will look like. You'll find this on page 4. For an uncomplicated pregnancy, our standard schedule is every 4 weeks until you're 28 weeks along, then every 2 weeks from 28 to 36 weeks, and then every week from 36 weeks until your baby arrives. If you have certain medical conditions such as high blood pressure, diabetes, thyroid issues, or a previous complicated pregnancy, we may add extra visits or extra monitoring. That's something we'll talk through together based on your specific history. At every visit, we'll check your weight, your blood pressure, do a quick urine test, and listen to your baby's heartbeat. Around 22 weeks, we'll start measuring something called fundal height. That's just a measurement from your pubic bone to the top of your uterus, and it gives us a quick check on how baby is growing. We do require delivery by 42 weeks. If your pregnancy goes past 40 weeks, we'll add additional monitoring, usually ultrasounds and fetal testing, to keep an eye on your baby's heart rate and to make sure your placenta is still doing its job. The placenta is an incredible organ, but it's only designed to last so long. After 40 weeks, it can start to age and calcify, so we want to be extra careful in those final days. Now, let's talk about ultrasounds. You'll have an early ultrasound at the start of your pregnancy to confirm your due date. Then between 20 to 25 weeks, you'll have what we call your anatomy scan. This is the big one. By that point, your baby is developed enough that we can really take a thorough look at all the major systems: the brain, the heart, its chambers, the stomach, the kidneys, the bladder, the spine, the limbs, all the fingers and toes, the amniotic fluid, the placenta. And sometimes if it is too early, we won't be able to see everything we need to see. So a repeat might be needed. To avoid this, our sonographers actually recommend the anatomy scan begin somewhere around 22 weeks. That anatomy scan is also when we can usually tell your baby's sex if you want to know. Some patients want to know right away, others want to wait. Either is wonderful. Just let us know which camp you fall into. Beyond those, additional ultrasounds are done as medically indicated. Insurance generally only covers ultrasound when there's a medical reason for them. If you're over 35 or you have certain health conditions, you may also be referred for a level 2 ultrasound with a perinatologist. That's a maternal fetal medicine specialist, and that is done at a different office. I want to spend a few minutes talking about genetic screening because this is on page 4 as well. It's an area where patients have a lot of questions. Around 9 to 10 weeks of pregnancy, we offer 2 optional blood tests, NIPT and carrier screening. I want to emphasize the word optional. These are not required. They're available to you, and the decision is entirely yours. Let's start with NIPT, which stands for non-invasive prenatal testing. It's a blood draw from you, that's all. The test looks at fetal DNA that's actually circulating in your bloodstream, and it screens for certain chromosomal conditions like Down syndrome, trisomy 18, and trisomy 13. As a bonus, it can also tell your baby's sex, and it can do that as early as 9 to 10 weeks, which is much earlier than the anatomy scan. We can't run NIPT before 9 to 10 weeks though, because there just isn't enough fetal cells in your blood for the test to be accurate yet. The second test is carrier screening. This one looks at your genetics to see whether you carry any recessive conditions, things like cystic fibrosis, certain muscular dystrophies, or inherited blood disorders like sickle cell or thalassemia. Here's how carrier screening works. If you come back as a carrier for something, that doesn't necessarily mean your baby will have that condition. It just means you're carrying one copy of the gene. We have a test that automatically reflexes to the baby and will tell us your baby's risk of inheriting the condition. If this shows higher than normal risk, the next step is to test the baby's father. If he is also a carrier for the same condition, then your baby has about a 1 in 4 chance of being infected. That's important information for some families. It can help with planning, and it can help with knowing what to look for after birth. If only one of you is a carrier, your baby could be a carrier too, but it's very unlikely to actually have the disease. If your insurance does not cover the testing, there may be an out-of-pocket cost. The billing team for the company processing the test can provide the most up-to-date pricing information before you make a decision. We don't want any surprises here. We'd rather you make this decision with all the information upfront. There are also a few more advanced tests like amniocentesis and CVS, which stands for chorionic villus sampling, that can give definitive answers if a screening test comes back abnormal. We don't usually start with those, but we can absolutely discuss them at your appointment if it's relevant to your situation. Beyond the optional tests, there's a panel of standard labs that we run for everyone at your first visit. You'll find those on page 4. We check your blood type and your Rh factor. I'll come back to that in just a moment. We check that you're immune to rubella, which is also called German measles. We screen for HIV, syphilis, hepatitis B, and hepatitis C. The state of Texas also requires us to screen for gonorrhea and chlamydia at your first prenatal visit. And if you're due for a pap smear, we'll go ahead and take care of that too while you're with us. We'll also collect a urine sample at every visit, starting with your first. Urinary tract infections can be more common in pregnancy, and they can cause issues like contractions if they go untreated. so we keep a close eye on this. Every other time, what we're doing is called a urine dip. We're checking right there in the office for things like protein, sugar, or signs of infection. We don't send every sample to the lab for a culture, so if you don't see a urine result in your patient portal after every visit, that is normal. If something on the dip looks suspicious, we'll send it for culture, and we'll absolutely let you know. Okay, let's come back to the Rh factor because this one's important. When we check your blood type, we're looking at two things, the letter A, B, or O, and the Rh factor, which is positive or negative. If you are Rh negative, that's something we need to be aware of throughout your pregnancy. Here's why. If your baby happens to be Rh positive, which we won't know for sure until birth, there's a chance that during delivery, your baby's blood and your blood can mix briefly. If that happens, your immune system can start making antibodies against Rh positive blood. That's not really a problem for this baby, but it can become a serious problem for any future pregnancies. Fortunately, we have a very effective medication called RhoGAM. If you're Rh negative, we'll give you a RhoGAM injection around 28 weeks and then again within 72 hours after delivery of your baby, if your baby turns out to be Rh positive. We may also give you an extra dose of RhoGAM at any point in your pregnancy if you have bleeding or trauma to your belly, like in a car accident. So if you're Rh negative, please make a mental note. Any bleeding, any abdominal trauma, call us right away. That way we can decide whether you need an extra dose to keep things on track for next time. Still on page 4, let's talk about vaccines. There are a few vaccines we'll talk with you about during your pregnancy. All of them are recommended, but none of them are required. We'll go over your situation and your preferences together and answer any questions you have. The big one is TDAP. We give this around 28 weeks, often at the same visit as RhoGAM if you need it. The P in TDAP stands for pertussis, also known as whooping cough. Whooping cough can be very dangerous, even life-threatening for newborns, but in adults, it feels like a mild cold or allergies. By getting the vaccine during pregnancy, you pass protective antibodies to your baby through the placenta, and those antibodies cover your baby until they're old enough to get their own shots at the pediatrician office. So this one really is for your baby, and anyone who is going to be in close contact with your baby should get this vaccine as well. If you're pregnant during flu season, we recommend the flu vaccine. Pregnant women are more susceptible to severe flu illness, and just like with TDAP, the antibodies cross the placenta and protect your baby for the first few months of life. There's also a maternal RSV vaccine. It's recommended between 32 and 36 weeks of pregnancy if you're due to deliver during RSV season, which is generally fall through January. RSV can make babies very, very sick. Some of them end up in the NICU, so this vaccine helps protect your newborn during the months when they're most vulnerable. The CDC also currently recommends the COVID vaccine in pregnancy. We're happy to talk through where you are in your COVID vaccine history and what makes sense for you. I know vaccines can feel like a lot to think about. We're happy to go through any of them in more detail at your visits, share the data with you, and answer your questions. There's no judgment and there's no pressure, just information so that you can make an informed decision for you and your baby. Page 5 and 6 are probably the pages you're going to come back to the most. This is where we cover safe medications during pregnancy for everything from colds and allergies to constipation, heartburn, headaches, you name it. I want to talk through a few of the most common ones because I get questions about these literally every day. Heartburn in pregnancy is almost universal. Tums are great for the occasional, oh, I had spicy food and now I regret it, kind of heartburn. But if you're getting heartburn every single day, and a lot of you will, please don't sit there eating Tums like candy. There's a medication called famotidine, brand name Pepcid. It's safe in pregnancy. You can take it daily, and it works really well for the long-haul reflux that pregnancy tends to bring on. Constipation, also extremely common. The hormones of pregnancy slow down your entire GI system. Everything just moves a little more slowly, including your bowels. The first thing I want you to do is hydrate. Pregnant women should be aiming for 80 to 100 ounces of water a day. I know that sounds like a lot. It is a lot, but it makes a huge difference. Combine that with a high fiber diet, plenty of fruits and vegetables, and if you're still struggling, a stool softener like Docusate, brand name Colace, is safe and listed on these pages. Hydration will also help you in labor, as the uterus is a muscle and requires adequate hydration to contract effectively. Pregnancy hormones make all of your mucous membranes more swollen, your nose, your sinuses, your throat. A lot of people are surprised by how stuffy they feel, or how much more saliva they're producing, or how much more vaginal discharge there is. All of that is normal. It's just your body responding to hormones. Claritin and Zyrtec are both safe in pregnancy. Flonase, the nasal spray, is also safe. It's a very small amount of localized steroid and can be a real game changer for nasal congestion. Those middle of the night Charlie horses are a classic pregnancy complaint. Magnesium is your friend here. There's a magnesium lotion you can find at most pharmacies and online. I tell my patients, rub it into your calves and your feet at bedtime. And honestly, that can be your partner's job. A little massage, a little magnesium, go to sleep. Increasing potassium-rich foods like bananas and potatoes can also help. And once again, water, water, water. Tylenol is your safe go-to for headaches. Cool washcloth, dark room, and hydration. The thing I want you to watch for is a headache that comes with vision changes after 20 weeks. Seeing spots, blurry vision, or pain in your upper right belly. Those can be signs of high blood pressure in pregnancy, and we want to know about them right away. Pages 5 and 6 also covers medications for things like nausea, sleep, allergies, antibiotics, and a lot more. When in doubt, check the page first, and if you don't see what you're looking for or you're just not sure, call us. We are happy to tell you whether something is safe. Page 7 covers nutrition during pregnancy. Let's hit the highlights. First, the question everyone asks, how much weight am I supposed to gain? The honest answer is, it depends on where you started. The chart on page 7 breaks it down by your pre-pregnancy BMI. Generally speaking, if you started underweight, you'll aim to gain a little bit more. If you started at a healthy weight, the typical range is 25 to 35 pounds. If you started at a higher BMI, the recommendation will be a little less. But these are general guidelines. We're going to look at your specific situation and adjust as needed. I will also say this, please try not to obsess over the number on the scale. Your body is doing something incredible. Some weeks you'll gain more, some weeks you'll gain less. What we're really looking for is a steady, healthy trajectory. You don't actually need to eat for 2. Pregnancy bumps up your daily calorie needs by only about 100 to 300 extra calories, which is more like eating for 1 and a snack. Half a peanut butter and jelly sandwich and a glass of milk, that's about it. Focus on quality, lots of protein. That's critical for your baby's growth. Plenty of fruits and vegetables, whole grains, healthy fats, and of course, your prenatal vitamin every day. Your prenatal vitamin should contain folic acid, which helps prevent neural tube defects. We actually recommend taking a prenatal vitamin even before you conceive if you can, and continuing it through breastfeeding. There are a few key nutrients we want to make sure you're getting enough of. Calcium for your baby's bones and teeth, iron for blood production, and to keep you from feeling exhausted, vitamin D, vitamin C, the B vitamins, and folate. The chart on page 7 walks through where to find each one in food. If you're vegetarian or vegan, that's totally manageable in pregnancy. We just want to be intentional about iron, B12, and protein. Things like beans, lentils, leafy greens, tofu, and fortified cereals. And we may recommend some supplements on top of your prenatal vitamin to fill in any gaps. If you have lactose intolerance, you may actually find your symptoms get a little better in pregnancy. But if you're still struggling with dairy, let's talk about it. Calcium is in a lot more than just milk. Leafy greens and fortified juices have it too. And artificial sweeteners are okay in moderation, 1 or 2 servings a day. If you have gestational diabetes, they can actually be a useful tool for keeping your blood sugars in control. Page 8 is where we talk about foods to avoid in pregnancy. This is another page that comes up at almost every visit, and the truth is the list is shorter than people sometimes think. No raw fish. That means no sushi with raw fish, no ceviche, no raw oysters. Cooked sushi rolls are completely fine. Cooked shrimp, cooked calamari, fine. Just make sure shellfish is cooked through. Avoid soft cheeses made from unpasteurized milk. Things you'd find in a specialty cheese counter, like some blue cheeses, some bries, queso fresco from a small producer, anything labeled unpasteurized or raw milk. The mainstream grocery store cheeses, your cheddar, your mozzarella, your parmesan, those are pasteurized and they are absolutely fine. Fish high in mercury need to come off the menu for now. That's shark, swordfish, king mackerel, and tilefish. For other fish, you can have around 3 servings a week. The concern with deli meats is a bacteria called Listeria, which can survive cold temperatures. We recommend heating deli meats until they're steaming before eating them. So if you're at a sandwich shop, ask them to heat or toast it. At home, pop the meat in the microwave for a few seconds. Same goes for hot dogs. Make sure they're cooked thoroughly. That little step takes care of the risk. Avoid raw eggs. That includes some homemade Caesar dressing, homemade mayonnaise, raw cookie dough, and homemade ice cream. Cooked eggs are completely fine. Just make sure the yolk is firm. Wash all your fruits and vegetables well. There's a parasite called Toxoplasmosis that can live in soil, and washing produce protects you from that. Caffeine. Yes, you can still have it. We recommend limiting it to 1 cup of coffee per day or the equivalent in tea or soda, and then make sure you're balancing that with plenty of water. And of course, avoid alcohol, but I'll come back to that in just a few minutes. If you're not sure about a specific food, just ask. Pregnancy already comes with so many what about this questions. We're happy to be your sounding board. Page 9 answers a lot of the questions I get at almost every appointment. Let me walk through them. When will I feel my baby move? For most patients, it happens between 16 weeks and the early 20-something weeks. It often feels like flutters or little bubbles or even gas. You may not be sure at first whether it's the baby or your stomach, and that's normal. One thing that can affect when you feel movement is where your placenta is sitting. If your placenta is in the front, what we call anterior, it acts like a little cushion, and it can take a bit longer for you to feel kicks. If your placenta is behind the baby, posterior, you'll often feel movement sooner. Either is normal. Once you hit 28 weeks, we want you to start paying closer attention to movement. The general guideline is 10 movements in 2 hours. If you've been busy and you suddenly realize you haven't noticed baby moving much today, sit down, put your feet up, drink something cold and sweet like juice or a glass of milk, put your hands on your belly. You should feel 10 movements within 2 hours. If you don't, call us. Early in pregnancy, sleep, however, is comfortable. Once you get to about 24 weeks and your belly is bigger, we'd prefer you not lie flat on your back for long stretches. There are major blood vessels, your inferior vena cava and your aorta, that run behind your uterus, and lying flat can compress them and reduce blood flow to your baby. Sleeping on either side is ideal. Even being slightly tilted off your back is fine. You don't have to be perfectly on your side. A pillow behind your back, a pillow between your knees can be very comfortable. And if you're waking up on your back feeling dizzy or sweaty, that's your body telling you to roll over. Don't panic, just shift position and you'll be fine. If your pregnancy is uncomplicated, you can travel, including by air, up to about 36 weeks. Always check with us first because there are some situations where we'd rather you stay closer to home. When you do travel, get up every couple of hours to walk around. Pregnant women have a higher risk of blood clots, and movement and hydration are your best defense. Pets are wonderful. If you have a dog, no special precautions. If you have cats, please let us know. Cats can carry a parasite called Toxoplasmosis, which lives in their feces. So while you're pregnant, we'd love for someone else in the household to handle the litter box. If that's not possible, wear gloves and wash your hands really well afterwards. Salon Treatments, hair color, manicure, pedicures are all generally fine. We just recommend them doing them in a well-ventilated space and if possible, holding off in the very first trimester just to be extra safe. We recommend avoiding hot tubs and jacuzzis entirely in the first trimester. After that, keep it short, under 15 minutes, and keep the water under 100 degrees. 30 minutes of exercise a day is great for an uncomplicated pregnancy. Walking, prenatal yoga, swimming, light strength training, stationary biking are all good. If you were already an athlete before pregnancy, you can usually keep doing what you were doing. Just listen to your body and modify as you go. What we don't want is for you to start a brand new high-impact sport at 24 weeks. And after 20 weeks, please avoid lying flat on your back for exercise and skip activities with a high risk of falling, like skiing, kickboxing, or horseback riding. Sex during pregnancy is okay as long as you don't have specific complications like bleeding, leaking fluid, or preterm labor concerns. You can absolutely have sex. It is safe. If your provider has told you to avoid it for a specific reason, follow that. Otherwise, this is part of your normal life and it's fine. For dental care, keep going to your dentist. Cleanings are great. Let your dentist know you're pregnant and have them shield your belly if they need to take x-rays. Pregnancy hormones can make your gums extra sensitive and even bleed a little when you brush. That's normal. Just keep up with good oral care. Page 10 is a short page, but it's an important one. There is no safe amount of alcohol during pregnancy. We recommend avoiding it entirely. That includes wine, beer, and hard alcohol. And anything labeled non-alcoholic beer or wine often still contains a small amount of alcohol, so check the label. The same goes for smoking. That's cigarettes, vaping, marijuana, and recreational drugs of any kind. Smoking during pregnancy is associated with low birth weight, preterm birth, placental complications like placental previa and placental abruption, and premature rupture of membranes, and even stillbirth. And these aren't scare tactics. Those are well-documented risks. If you smoke or drink and you're finding it hard to stop, please tell us. There's absolutely no judgment here. We have resources, we have programs, we have support, and we want to help you. The bravest thing you can do is be honest with us, so we can help you and your baby together. Page 11 is the page I want you to bookmark. It's a quick reference chart for when to call us and when to head straight to the hospital. In bold, at the top of that page, you'll see our office number. That number is good 24 hours a day, 7 days a week. There are some things that are always a call right away. Let me walk through those. Continuous leaking of fluid. That's your water breaking. Call. Heavy vaginal bleeding, soaking through a pad in 2 hours. Call. A fever of 101 degrees Fahrenheit or higher. Call. A severe headache, especially one with vision changes like seeing spots or blurriness or pain in your upper right belly. Those can be signs of preeclampsia, and we want to know. Decreased fetal movement after 28 weeks, fewer than 10 movements in 2 hours after you've tried sitting down, hydrating, and counting. Call. Painful contractions more than 6 times in an hour if you're under 36 weeks. Call. A car accident or any significant trauma to your belly. Call. Pain with urination, blood in the urine, or that urgent feeling without much actually coming out. That could be a urinary tract infection, and we want to treat it quickly. The chart on page 11 lays a lot of this out side by side. What's a call us today thing versus what's a go to labor and delivery now thing. And one more important point. Please call us directly for any of these. Don't send a message through the patient portal. Portal messages can take up to 5 business days to be answered, and these things can't wait. When in doubt, call. Truly, we would much rather hear from you and tell you everything is fine than have you sitting at home worrying. That's what we're here for. Page 12 walks through how to prepare for labor and delivery. There are a few things we want you to do ahead of time. First, pre-register at the hospital. We will give you the information on how to do so around 28 weeks. That way, when you arrive in labor, the admitting process is smooth and quick. You can also schedule a tour of the birthing suites at Baylor McKinney on their website. Tours book very quickly, so it's best you book as soon as possible for around 34 to 36 weeks. Think about a birth plan. You don't have to write a formal document, but it's helpful to start thinking about what kind of experience you'd like. Do you want an epidural? Are you hoping to go without pain medication? Do you want to try hydrotherapy with the use of the shower in labor? Any preferences around delayed cord clamping, skin to skin, who's going to cut the cord? Bring all of that to your visits and we'll talk it through. And please know, birth plans are guides, not contracts. Sometimes things can change in the moment and we'll always do what's safest for you and your baby, but we want to honor your preferences as much as we possibly can. Pick a pediatrician. You'll want to have one chosen by the time you deliver because the hospital will send your baby's records and test results to whoever you've selected. Your baby will typically be seen by their pediatrician within a week of going home. Make sure the pediatrician you choose is in your insurance network and is taking new patients. If you're having trouble finding one, just ask us. We have a list. Get a car seat installed. By Texas law, your baby cannot leave the hospital without a properly installed car seat. Install it before your due date so you're not scrambling at the last minute. Some local fire departments offer car seat checks, but you have to call ahead. Not all of them do this anymore. The hospital staff cannot help check the fit when you're ready to go home. Take a class. This one I really recommend, especially for first-time parents. We have our own virtual childbirth class called Prepared Childbirth, which walks you through labor and delivery, the first 6 weeks postpartum, and many more. I also recommend breastfeeding classes, infant CPR, and baby basics, which are available through Baylor. Taking classes with your providers in your delivering hospital will benefit you the most as it gives you exactly what to expect. Pregnancy can feel like it goes fast, and these classes are a wonderful way to feel more prepared. Cord blood banking. This one's optional. You can choose to have your baby's umbilical cord blood collected and stored. It contains stem cells that could potentially be used for medical treatment if your child or family member needs it. There are several private companies that offer this service, all with different prices and plans. Insurance does not generally cover it. There's also an option to donate your cord blood, which is a wonderful thing if you're not interested in private banking. If you want to bank or donate, the company will send you a kit ahead of time and you'll bring it with you to the hospital. Just let us know in advance so we're prepared to collect it. Breastfeeding. And finally, read up a little on breastfeeding before you arrive. Breastfeeding is a learned skill for both of you. The hospital has lactation consultants on staff who will help you in those first hours and days. The more you know going in, the more confident you'll feel. Page 13 covers labor and delivery and what to expect. How do I know I'm in labor? Let's start with the question I get most often. How do I know I'm actually in labor? Around 36 weeks and beyond, it's normal to start having occasional contractions, cramping, tightening. Your uterus is essentially practicing for the big day. We call those Braxton Hicks contractions. They tend to be irregular, they don't get progressively stronger, and they often go away when you change position, drink water, or rest. True labor feels different. True labor contractions are regular. They get closer together over time, they get longer, and they get more painful. They keep coming whether you walk, rest, eat, or drink. They do not go away. And the pain often starts in your back and wraps around to the front. You may also notice what's called bloody show, a small amount of blood-tinged mucus from your cervix. If you think you might be in labor, the rule of thumb is contractions every 5 minutes, lasting 1 minute for 1 hour, 5-1-1. That's a good time to head to the hospital. If you're under 36 weeks and contractions are coming every 15 minutes, call us right away. If your water breaks, whether or not you're having contractions, call us. Once your water breaks, we know baby is coming one way or another and we want you monitored. Now, induction. If your pregnancy is uncomplicated and you're at term, the earliest we can do an elective induction is 39 weeks. We don't induce earlier than that without a medical reason because babies do a lot of important development in those last few weeks. A baby born even 1 week early is more likely to have respiratory issues or need extra support in the special care nursery. Some patients hit 39 weeks and they are ready, done, get this baby out. Other patients prefer to wait and let labor start on its own. There's no right answer. It's about what makes sense for your body and your situation. After 40 weeks, we'll add monitoring to make sure your baby is doing well. By 42 weeks, we want delivery. You have options when it comes to pain in labor. Epidurals are the most common. A thin catheter is placed in your back during active labor, and medication drips through to provide ongoing pain relief. Epidurals are very safe. Like anything, they have small risk, and you will be given information from the anesthesia team at Baylor around 11 to 14 weeks. If you rather avoid an epidural, there are other tools. Nitrous oxide, laughing gas, is available at Baylor McKinney. It doesn't take pain away, but it can really help you cope through contractions. IV pain medication is another option, although we generally don't give it past 6 centimeters because it can make babies sleepy at delivery. Water therapy in the shower is wonderful. Wireless monitoring lets you walk around, move, change positions, and use birth balls without being tethered to a machine. You can also choose unmedicated birth. Many of our patients do that, and we fully support that. Sometimes a planned vaginal birth becomes a C-section. Maybe because labor isn't progressing or your baby isn't tolerating contractions well. Sometimes a C-section is planned ahead of time. Either way, the OB performs the surgery, but our midwives are trained to assist in the operating room. So if you've been with a midwife throughout your pregnancy and you end up needing a C-section, you don't lose your midwife. She'll be right there with you. If you've had a C-section before and you're hoping for a vaginal birth this time, what we call VBAC, we do support that for patients who are good candidates. We'll talk through the risk and benefits at your visits. After delivery, whether vaginal or cesarean, you and your baby will spend about 2 hours in the recovery area for close monitoring. After that, you'll move to the postpartum unit, which is on the same floor as labor and delivery. One more topic that comes up a lot is circumcision. If you're having a baby boy and you'd like a newborn circumcision, our office can perform that in the hospital, usually on day 1 or day 2. Circumcision is optional. Totally up to you and your family. We do require that baby has received the vitamin K injection first because newborns don't have strong clotting factors yet, and we want to keep them safe. If you decide to wait and have the circumcision later, that would typically be done by a pediatrician or urologist outside of our practice. Page 14 covers postpartum, and friends, this is the chapter I wish more pregnant patients paid attention to. Postpartum is its own season and it deserves preparation. Let's start with appointments. After a vaginal delivery, we'll plan to see you at 6 weeks postpartum for a checkup. After a cesarean delivery, we'll see you twice, at 2 weeks for an incision check and again at 6 weeks for a full postpartum visit. At those appointments, we'll check your healing, talk about birth control, ask about how feeding is going, and check in on how you're doing emotionally. Please be honest with us. The postpartum period is intense, and we want to support you, not just patch you up. A few practical things to keep in mind in those first weeks. Vaginal bleeding can continue for 6 to 8 weeks while your uterus shrinks back to its pre-pregnancy size. You'll have heavier days and lighter days, and increased activity tends to increase the flow. If you're soaking through a pad an hour or passing large clots, call us. No tampons, no douching, no swimming, and no submerged baths in those early weeks. That includes hot tubs and pools. Showers are fine. Sitz baths are great, especially if you've had stitches. If you had a cesarean, no driving for about 2 weeks, and avoid lifting anything heavier than your baby until your follow-up. Keep your incision clean with soap and water, and call us if you see redness, swelling, unusual drainage, or develop a fever. For sex, please wait 6 weeks or until your stitches are no longer painful. We'll talk about birth control options at your visit because, fun fact, you can absolutely get pregnant again before your first postpartum period. Now, I want to spend a real moment here on postpartum mental health. About 40 to 80% of new moms experience the so-called baby blues. Mood swings, weepiness, feeling overwhelmed. These usually start a couple of days after delivery and resolve about 2 weeks later. Sleep, hydration, support from people around you, those are your best tools. But sometimes the baby blues don't lift. Sometimes what looks like blues turns into postpartum depression or postpartum anxiety. Signs to watch for: persistent sadness, intrusive scary thoughts, not feeling connected to your baby, struggling to care for yourself or your baby, panic attacks, and intense worry that doesn't go away. If any of that resonates with you, please reach out to us day or night. Postpartum depression and anxiety are very common and they're very treatable. There is absolutely no shame in needing help. Our practice has a lot of experience with this, and we will get you the support you need. If you're breastfeeding, keep taking your prenatal vitamins. Eat well and aim for 10 to 12 glasses of water a day. If you notice signs of a breast infection, fever, flu-like body aches, a hot or red area on your breast, call us. Breast infections are common and they're easy to treat early. If you're not breastfeeding, wear a supportive bra, use ice packs for engorgement, and Tylenol for discomfort. Your milk will dry up over a couple of weeks. Be gentle with yourself in this season. You just did an incredible thing. Healing takes time. Bonding takes time. Sleep when you can. Give yourself grace. That brings us to the end of our OB education class. We just covered a lot, probably more than you'll remember in one sitting, and that is completely okay. This video is here for you to come back to as many times as you need. Skip around, rewatch the chapters that feel most relevant to where you are in your pregnancy, and use your pregnancy guide as your reference between visits. If something we talked about today raised a question, write it down. I tell my patients this every visit. As things come up at home, jot them down on your phone, in a notebook, anywhere. Bring those questions with you, because at every appointment, after we check your blood pressure and listen to your baby, the first thing I'll ask you is, what questions do you have for me? There will be questions. There should be questions, and that is what we're here for. From all of us at Adriatica Women's Health, thank you for trusting us with your care. We are honored to be part of this journey with you, and we cannot wait to meet your baby. Take care of yourself, take care of each other, and we'll see you at your next visit.